So we presented here the results from the POLARGO trial. This was a globally conducted randomized phase 3 trial in patients with relapsed or refractory large cell lymphoma who were deemed transplant ineligible. Patients were randomized in a 1-to-1 fashion to receive either R-GemOx chemotherapy or R-GemOx plus polatuzumab vedotin, the antibody drug conjugate targeting CD79B. What we found is that the addition of polatuzumab to this program, the so-called POLARGO regimen, significantly improved clinical endpoints, with an improvement in overall survival, the study's primary endpoint, with a hazard ratio of 0.6. What this means is that there was a 40% lower risk of death with this study therapy. We saw meaningful improvements as well with other key secondary endpoints, including progression-free survival, complete response rate, and overall response rate, with a doubling of response with the addition of polatuzumab to the R-GemOx backbone. Along with this, we did see an increase in toxicity. It's worth noting that patients received almost 8 cycles of therapy on average with POLARGO versus only 4 cycles on average with the standard of care R-GemOx. And with additional treatment is expected to come additional toxicity. That said, there was an increase in neuropathy, which was notable, generally low grade in severity, and some patients recovered at the end of treatment. There was an increase in grade 5 events with the study-based therapy as well, although a minority of these were attributed to the study therapy. The most common cause of death other than progressive disease was infection, and the most common infectious cause of death was COVID-19. It's worth noting that the study was conducted during a time that was considered more peak COVID. In summary, the results are that we are able to significantly improve outcomes and improve survival of patients with relapsed or refractory large cell lymphoma by adding polatuzumab vedotin to an R-GemOx backbone. This represents a new meaningful addition to the therapeutic armamentarium and a new tool for clinicians treating patients in this context.